an opportunity to learn a little bit about our upcoming online instruction. And then we will expect that our website will be updated with information for parents beginning as no later than July 27th. So by the end of the month, having all of our online information on the school district's website. We will be hosting online virtual sessions for parents to learn more about that program, just like you signed up to be part of this session tonight to provide feedback and learn about our health and safety plan. There'll be opportunities the last week of July and the first week of August to learn about the online program that will be available for all students if parents wish. And finally, just like you do every year, you re-register in Skyward to update information for your children, for their emergency contacts and new medical records, that kind of thing. You will have the opportunity in that same Skyward registration process to indicate whether you want your child to be in-person instruction or attending our cyber program. So just a little bit about, dates and times. Like I said, end of the month is really our target for getting this all out onto the website. First glance at it next week, but then really the full program available on the website by the 27th with online virtual sessions, open house sessions that people can attend that week as well as the following week.
Okay. Thank you, Dr. Soeder. So I think the thing to keep in mind with all of the information that we're sharing is I have never experienced a situation where information changes and guidelines change that we receive truly on a weekly basis, sometimes a daily basis. And so what I want us to think on is when we think about our health and safety plan, when you think on our cyber academy, I like to think of it as a funnel. And right now we're sort of thinking big picture. We're at the kind of the top of the funnel. And we have several of those sort of large funnels right now. As we continue to get more information and refine our plan and get feedback from all of our stakeholders, we'll continue to kind of move our way down through those funnels and really get to the level of minutia that is very important. They always say, it's all in the details. And in some respects, we have thoughts on what those details are going to look like. But in some respects, we need to get input and move that along carefully and methodically. Because quite honestly, that could change tomorrow. So a plan that we create today, for instruction or these kinds of things could change based on the current situation and the guidelines that we get. So we're going to hopefully help me with trying not to sort of get stuck, in the details in terms of, hey, what are you doing for these little specific details? We'll get that information to you. We just may not be there yet. So let's start with taking a look at the plan. So if you remember, it was kind of divided into 4 sections. Our first one was cleaning, sanitizing, disinfecting, and ventilation. So the patterns or the themes that we saw from the survey results had a couple things on them. Number one, I'll start with the majority of the respondents were over at least, felt satisfied with the majority of the components of the plan. But some things that came out of it, parents were interested in the process of limiting the number of children allowed in bathrooms. And that's certainly something that we can, easily sort of manage and control at a classroom level. But, I'll be honest with you, again, if that child is there and they're in the cafeteria and we know one other student already asked permission and is using the restroom, but that little other child comes up and absolutely you can tell they have to use their bathroom immediately, we're going to let that other child go into the bathroom. We'd much rather do that and deal with that than obviously allow a student to have an accident or something like that. So although we'll have controls in place and management things in place, we're also elementary school. these are kids, we're going to be reasonable about those types of expectations. Ventilation, I was surprised. I would not have necessarily guessed that, but ventilation came up. A lot of people are thinking in terms of what are some of those operational type things that we can use. So Mr. Rothrock, I see you're still with us. I'm going to turn it over to you since this is your bread and butter.
All right, Todd, thank you. So every HVAC or heating, ventilation, and air conditioning system in the building operates on a schedule. They turn on in the morning and they turn off in the afternoon when everyone leaves. Every occupied space in the building gets fresh air through this HVAC system, and it also gets filtered through this HVAC system. So what we are doing is we are turning the system on 2 hours before the normal start of the day, and we're leaving it run 2 hours after the normal end of the day to bring in more fresh air and to also get extra passes through those filters to make sure the air stays nice and fresh in the building. You know, and the more fresh air we bring in, the more old air gets exhausted out through the building, so you get proper air changes, you know, so we keep the air clean in the buildings.
Right.
And another question that always comes up are the windows, and should the windows be open? The buildings are designed to have the proper amount of outside air brought in through this HVAC system, and it's also filtered. If the windows are open, not that much air comes through them anyway, and what does come through isn't going to be filtered, so it's better to let it come in mechanically through the system.
Okay. How about filters as well? You had referenced that. Did you want to talk a little bit about filters? Because I know that came up in the survey.
Yeah, the filters are going to be changed as they are every year at the start of the school year. They are the highest rated capacity for the design of that system, and they're changed every 4 months. So we keep them fresh and operating at their peak performance.
Perfect. Thank you. All right. So if you had any questions related to HVAC, you can let me know. I know some people apparently very much more in the know than I am, but they had referenced ASHRAE, which I think is a leading organization on sort of HVAC. And so, Mr. Rothrock, I know on that one of those previous slides, we had mentioned that organization as one of those groups that you know, we do look at what they're putting out. Is that accurate?
Yes, that's correct. ASHRAE's, they set a lot of the standards for how heating, ventilation, and air conditioning systems should be run. So we follow many of their guidelines in all the buildings in the district.
Perfect. Thank you. So while we're talking about facilities, some other things that we're doing from a facility standpoint to help keep everyone as safe as possible. If you've been to East Coventry recently and you paid attention to the type of water fountains we actually have 2 types. We have bottle fillers, and then we have the traditional type where, you know, you put your mouth close to. So what we're doing is we are only going to be using the bottle fillers. And so the others will be turned off. So our students will be encouraged to, you know, bring refillable water bottles with them. And so, you know, again, that's just one more you know, thing that we can easily sort of put into place. Cleaning also came up as well, and you'll see that a theme throughout. Families and very interested in sort of like, okay, what are you doing about cleanliness? I know in your homes, like my homes, you're probably wiping a lot of disinfecting, high touch areas, and so the district is going to be including a daytime housekeeper on staff in each of the buildings, not shared, in each of the buildings. And their primary responsibility will be to take care of those high touch areas. And so we envision that they will have a schedule that they'll follow, and that schedule will mirror our building schedule. And so what that means is, let's say, for instance, 2nd grade. So 2nd grade students at some point in the day will be leaving their classroom for, if we're in the green phase, for recess and lunch. And so we know that students then will not be in the classrooms, and that would be part of the housekeeper schedule to go in and wipe those high touch areas as well, circulating through the children bathrooms throughout the day, following a schedule, and doing just everything that that person can to kind of help us with the high touch areas. And so, that's something that has not been in place before, where we've had the evening housekeepers. They still will be here, but we'll also have someone on day staff as well. All right, as far as classrooms go, masks are something that a lot of our families are asking about, and we'll get into that shortly. As far as sanitizing and disinfecting, we'll make sure that our classrooms have an adequate supply of disinfectant, so that it can be cleaned throughout the day if the teacher so chooses so. And then also you'll have students who will also sort of take part in that. And then obviously encouraging students to, hand wash and use the sanitizers. And if you've been in our classrooms, especially our primary classrooms, that's already an important part of their day when they use what they call the magic soap in kindergarten. So that will just become part of our routines and our expectations. And we'll work with our teachers in the beginning of the year to set up those sort of natural times that it makes sense to make sure that students are either washing hands, using hand sanitizer, or both. And then the other thing I'm thinking of is hand sanitizer stations being added outside on our playground. We currently don't have those because those students will, when they're finished outside on the playground, will either be coming in the building and going to lunch, or they would be returning to their classrooms. So it makes sense that the children have an opportunity and are encouraged to sanitize their hands before they come back in the building for recess or for lunch. So the questions come up, what if there is a confirmed case? Like, how do we respond to it? And we do have a comprehensive plan how we respond to that. I'll turn that over to Mrs. Kohler in a few minutes, sort of when we get to that portion of it. But as far as from the cleaning and sanitizing end, we would, if we have a suspicion of a case in a classroom, or it is confirmed, we would sort of quarantine that area, or depending on the intensity and the level, we would need to make a decision about shutting the entire school down. We would do what we call area tracing. So in other words, if that student was traveling around the building throughout that day, what other classrooms or what other areas or what other adults came in contact and what other children may have come in contact with that student, and so that we know then those areas that we need to focus on from a cleaning and standpoint. We have a process called electrostatic cleaning, which is sort of this magical process that somehow even cleans underneath tables. I'm not sure exactly how it works. I wish I had one of those at my home, but we also would employ something like that throughout either the classroom or classrooms, or the spaces that the child was in, or if it is the entire building, then we would take care of treating the entire building, and we'll talk about that a little bit. That would include a bus as well. If we know that that student came in on a bus, that bus would be removed from service, would receive what they call a deep clean, and then a reinspection before put back into service. Okay. I'm going to move on. Let me just take a look what we have here. So these are just some of the other things. Sharing of materials. So, what are we doing with students sharing materials? And in the past, we would have a lot of sharing of materials, a bin of crayons. Everyone go get a crayon. So this year with our school supply list that we've asked our parents to provide, and those additional things that the school is providing, we are really going to be able to limit the sharing of materials. So everyone will have their own crayons. Everyone will have their own materials. And I really wouldn't be surprised as well, even though you received that school supply list, that once we start school, again, you don't know what you don't know. Our teachers might find, boy, you know what? It would be great if we could have just a small crate that can slide underneath the child's desk or seat that can give them just a little bit more storage. So our teachers may be reaching out to you or reaching out to the school to say, hey, any possibility that we could have a few additional materials that we didn't anticipate. But the school supply list is a good place to start. We're also looking at our special areas because that's an area where obviously students go to the art room and it's shared. So we'll have some procedures in place as well to minimize and reduce the amount of materials that would be shared with the ultimate goal of hopefully being really able to almost eliminate it. And it could be the kids take their own materials to art, you know, if they're going to be doing a project that they need crayons or a scissors of that day. So it's just communication between our special areas and our regular area teachers. Addressing how transportation will limit the close contact of students. So that came up in the survey. Bus drivers being trained. So yes, there's going to be a lot of professional development, not only for our bus drivers, but for our staff as well, in terms of, okay, here are some new ways of thinking and some new ways that, you know, we need to put in place. So, all right. Now I'm having difficulty here going to, okay, there we go. It's jumping a little bit on me. Sorry. Okay. So Q&A. So these are some of the, just some things that came up in the survey that we can easily respond to. Some of them we've already sort of touched on. We talked about a single building needed to be closed. Is that a reality? It could be. Again, depending on sort of the level of, you know, contact tracing that illustrates that, you know, we had a student who was in a large portion of the building, or we have a number of confirmed cases. But it could be that we need to shut down one of our schools while the other schools stay open. And really to do an entire building could take from 2 to 5 days. Again, I go back to that electrostatic cleaning process. And so we talked about the HVAC systems. We talked about sharing items, windows on the bus. So we talked about, how about windows in the classroom? Windows on the bus, you know, obviously the bus does not have the same mechanical ventilation systems that our buildings have. And so the only way really to increase that ventilation is to look at the windows. And so a beautiful day like we had today would certainly make sense to keep many of the windows open. But some of the questions from, you know, you came back and said, well, what about if it's cold outside? What if it's really cold? Are you going to keep the windows open? We might. Doesn't mean we're going to keep them open all the way, but keeping them open, a few of them throughout the bus, an inch or so, if that increases ventilation, that certainly we would consider that. Again, we're going to be reasonable. If it's pouring rain outside and we know that students are just going to get soaked, having a window open even an inch, we're going to use our best judgment. But generally speaking, when possible, you know, we'll keep those windows open. How many seats, how many current students in a bus? So I say current because this could change. Guidelines state 2 seats, 2 students to a seat. Spoke to our transportation director today. We talked about this a little bit, and what will be very important will be also how many of our students are going to be taking that cyber option. How many students are we going to have on a bus? How many students are going to be coming in for live instruction? Once we get that information, that will be really helpful in terms of what it looks like for our buses and how many students. But they can easily put some things into place. So things like where the students sit, instead of having the kindergartners in the front, 6th graders in the back. Our transportation department is looking at having our families sit together instead of separating and having kindergartners front. So again, just to try to sort of manage the contact. And then also bus stops. We can easily assign students bus seats based on, you know, where they get on and off the bus. So, you know, those are easily things that we are going to be looking at putting in place. Okay. So that kind of takes care of cleaning, sanitizing. So that's our first of the 4 sections. I'm going to kind of give you a little time to reflect a little bit. Again, you have the opportunity to use those, that feedback form, you know, to give your thoughts regarding cleaning and sanitizing before we move on to social distancing. And I did tell you I turned the chat feature on, but unfortunately with this view, when I'm sharing, unless I'm missing something, unfortunately I'm not seeing the chat feature. Okay, social distancing. So this is something that was a very important part of our plan. We know what the suggestions are as far as distancing. Spend a lot of time sort of in the classroom, seeing what that looks like. And what I want to do right now is I'm going to press my luck here and see if I can share. Dr. Soeder, I'm going to ask you again. Can you see?
I can see the room.
Okay, perfect. Okay, great. So let's see. Move that out of the way. All right, so this is an example of what a classroom will most likely look like next year. You can see obviously some differences. I joke with my teachers. I said it's going to feel very old school when you look at the traditional rows and of desks. We, in our primary classes, always have had tables, kindergarten through second grade, but we replaced those tables with desks. So all of our classrooms will have desks in it. And so, looking at our classroom and the capacity of our rooms, and to what extent possible can we reasonably separate our desks, with a lot of the extra items taken out of the rooms this year. And that's going to be something that, is going to be a bit different, because our classroom teachers have, over the years, developed some flexible seating options, communal areas in the rooms, but really to maximize space and to reduce the possibilities of children being able to sort of, get together around 2 bean bags in the back. We've had to tell our teachers that for this year, we're really not going to be able to offer those things. So let's talk a little bit about space. And so what the guidelines say is 6 feet is ideal. But what our guidelines say is 3 feet is the target. Now, there's been a lot of discussion in terms of what is that, 3 feet from desk to desk, and it's 3 feet nose to nose. So with this arrangement, we can meet that requirement of 3 feet as a target. This is a classroom of about 21 or 22. I think there's a few desks there that you can't see. This would be probably close to most of our classrooms. Some of our classes have a few fewer students, but other than perhaps our 6th grade, who I think will have around 24 or 25. And we can fit that number of desks even with 25 students in it. 26 is really our capacity as far as our class list for policy, the current policy. So it does work. But again, I wanted to give you an idea in terms of what our classrooms will look like. So what happens when our students are, okay, hold on a second here. I can't chew gum and talk at the same time, so I want to get back and make sure that I'm sharing again. All right, Dr. Soeder. Sharing is paused. Please bring your shared window to the front. Okay, to the front. You see the classroom again, Dr. Soeder?
Not just yet.
No? Okay. See, told you I can't chew gum at the same time. New share. Let's try that. Share.
Mr. Oswald, on your screen, do you see what you want to be sharing with the rest of us?
I do, and I clicked on that. Who is that? Is that Mrs. Cresswell?
It is.
Hello, Mrs. Cresswell.
Hello, everybody. I told Mr. Oswald I'm wearing a baseball hat and not looking very professional right now, so I'm going to stay hidden, but let me see if I can come to your rescue.
Right,
so when you clicked share screen,
yep,
and then you actually clicked on the little icon to make sure that it highlighted that to come.
You know what I think I did? I think I accidentally got out of our presentation. So I'm just opening our presentation. You know, Mrs. Cresswell, I promised them that we did the dress rehearsal today, that tonight would be seamless. I jinxed myself.
I did hear you say that, but I actually think it's good because mistakes are just proof that we're trying, right? And we're learning from it. Always trying to coach us through. Is it coming up?
Slowly, yes.
Okay.
We'll get back there.
We should have put like together a fun little list of like jokes to tell while we waited.
All right, we're slowly getting back there. I think all of my principal colleagues are in the same document at the same time. Okay, let's try this again. I'm trying to get to our slide that we were on. All right. All right, let's try this. Present, and let's try.
Everybody cross your fingers.
Sharing screen again. Share screen. Okay. Mrs. Cresswell?
I see your entire desktop. So if you can click your actual screen. Are you seeing your Google Doc? That's what you see?
Yeah, I am.
Isn't that interesting?
All right, well, Mrs. Cresswell.
I know you want me to have a magic way to fix this. I do. Dr. Soeder, do you have a magic way to fix this?
Yeah, sorry, Todd.
We could bring some Play-Doh and glitter. Let's see. Oh, we got you.
There we go.
You did it.
Okay.
Good job. Okay, I'm muting again.
That wasn't even like a purposeful pause. That was like crickets.
I'm proud of you. You did it. Keep going.
All right, so if you're all right, then I'm not going to actually present. I'm just going to share it in this view so as not to jinx myself. Okay, so we had an opportunity to look at classrooms, and the important thing was looking at opportunities for social distancing. So this is kind of where masks come in. And so we know that the governor's order right now is for everyone, including our children, to be wearing masks. Now, here's what we know. Kids will be kids. We know that even as adults, we need breaks from wearing masks. And so we anticipate that our classroom teachers will build in opportunities for students to socially distance, meaning sort of move away from their work area, and they could use a small corner in the room that's designated and be able to do independent work or independent reading, and that would allow them to take the mask covering off. While we're talking about safety protocols, the question from parents have come up, well, okay, how about masks or how about face coverings? Which one is it going to be? Honestly, you know your kids, you know what they're going to be able to, what works for them, and for some students, that the mask is sort of too close and they feel more comfortable with a face shield. Our teachers will be alternating between both face shields and masks. And so whatever your child feels most comfortable with, we are going to be encouraging our children to wear masks. But that being said, we are not going to be mask police, and it's not going to become a disciplinary situation. What it will become is a conversation with a parent. Hey, we noticed that, there's been some issues with the mask. He or she has been hesitant to wear it. Let's work together. What are you hearing? What's he saying at home? What's she saying? And really kind of work through those types of issues that come with it. Now, obviously, if it's an issue that is a disciplinary issue, the student is not using it appropriately, or let's say the concern came up, what about a student who maybe makes fun of another student's mask? We're going to deal with that the way we deal with all of our concerns with teasing and those kinds of things. We're going to have lots of discussions. We're going to involve our parents. So that's kind of how we're looking at the idea of masks. we're looking at lunches and recess as well, since we know that students will naturally be together. In our green phase, we will have students in the cafeteria. Now, so some changes that we've put in place this year to try to reduce the number of students. So far, my schedule that is in draft form, but looking pretty good. In green, we will only have one grade level in the cafeteria at once. What that will allow us to do is spread kids out, alternate cafeteria seats, and eliminate that sort of face-to-face type thing. So the students will be there diagonally, still able to talk to their friends, but they'll be alternating. And with that arrangement, again, we go back to that kind of nose to nose. It's over 3 feet. I don't know that it's 4 feet, but it again allows us to maintain it. We know students then will need to take their masks off, obviously, to eat. Playground as well. We're looking at one grade level on the playground at one time. Now, what does that mean for time? So it means that in some of our grades, our students will have 20 minutes to eat lunch. What we found is, especially in our slightly older grades, honestly, the kids eat in 20 minutes. The last 5 minutes becomes a management issue. We do know that our kindergartners, or I'm sorry, our first graders will need a little bit more time. So our first graders will have some extra time to eat. That being said, again, we're elementary, we're reasonable. If we see someone truly is eating and they need additional time, we're absolutely going to give them the time that they need to finish their food. Now, if they've been talking the whole time and suddenly 2 minutes before lunch is over, then they want to eat, we're going to have a conversation with that child and remind them of the importance of, using the time as effectively as possible when they're in the cafeteria. All right.
Mr. Oswald?
Yes.
I did notice a couple of questions about that topic in the chat box.
Okay, I can't see the chat, so
right.
if
So I'm
you
going to
feel
read
it's
them to you.
Yep, if you feel it's an appropriate time, let's
Yep.
discuss
Will
it.
the eating area expand to the stage area or gym?
So good question. It will not extend to the gym area. Last spring, in my mind, I was thinking that perhaps we may need to use the stage area, but with the schedule that spreads the students out, and it has reduced the number of tables that we've required in there, it has also allowed me to increase the space even between the tables. So I don't think we're going to need the stage, but again, these plans are flexible. And if we find that we really do need to incorporate the stage, then we'll make that change. But at this point, I don't envision needing to use the stage.
Could we need a 6-foot distance between seats?
With using the stage?
It does not say.
I don't think that we could. I don't think that we would be able to maintain 6 feet of distance. But
Okay.
we will look into that, and we will include the stage area as well and see if that would allow us to do that.
Has thought been given to eating in the classroom to minimize movement around the facility and better maintain social distancing?
It has, correct. And so when you look at the plan, I believe in the yellow phase would have students eating in the cafeteria, in the classrooms, and lunches and things being delivered right to the classroom.
What about sanitation between grades in the cafeteria?
Yep. So what currently happens is the tables are wiped with sanitizer. So we would continue to utilize that, but that's where we're going to work with our facilities and our day housekeeper to see what other types of things need to be cleaned down there that are high touch areas.
And just to confirm, students will be 3 feet apart in the cafeteria to eat with no mask, but in a classroom 3 feet apart working must wear a mask.
Correct. Yes, correct. Again, we will investigate the cafeteria and see if there's other possibilities that do allow us to move 6 feet. I just don't know if our cafeteria tables, we would have the capacity, but we'll look into it. So good question. That's why we're having these discussions.
There were just a couple of questions that weren't connected to cafeteria, but I know that you've covered this. I think you'll be able to answer them. How flexible is our choice to go to traditional school versus cyber school? Will my child have the same teachers they would in traditional schooling?
Okay. So Dr. Soder, perhaps you'd like to help respond to
Right.
that. But the
So
answer is, yep, fluidity. We know that it's going to be fluid. We know that families may make a decision to start the year, and we know that that may change 2 weeks in, it may change 3 months in. So we are looking at fluidity. We are also looking at what I said before, that alignment. It's important that our curriculum, whether they're cyber or whether they're in person or whether they need to be out for a period of time, let's say because of an illness or let's say a quarantine, that our curriculum is fairly well aligned so that it allows for that fluidity. Dr. Soda, did you want to talk a little bit about staffing?
Staffing will really depend on the number of students who make the selection for online. And so, as Mr. Oswald suggested, if we have students who are going to be in our cyber program from multiple grade levels in different buildings, it's possible that a student from East Coventry could be assigned a cyber teacher who happens to be from North Coventry or West Vincent. We do expect that. It will just depend on the number of students in each school who make that selection. Mr. Oswald, there are a couple of other questions here about the cafeteria. If you want to just quickly do these ones.
Sure, please.
How will social distancing be maintained in lunch lines?
Correct. So it's not only lunch lines, it's really just encouraging our staff and our students to think a little differently in terms of, when we move from one location to the other, and encouraging our students to understand that typically we encourage them to line right up, you're right behind the person in front of them, but we're now looking at encouraging our students and having the expectation that they're allowing for space in between. From a facility standpoint, we're looking at some additional signage. I know you've all been in the grocery stores and things like that, where there's visual reminders as well. And so visual reminders in the hallway, we're looking at putting some additional markings in the hallway so that students understand that, hey, this is my side of the hall, this is your side of the hall. But also looking at what other types of visual type things can we put in the classroom, in the cafeteria, so when they are standing in line, they sort of have that visual representation. Okay, this is where I'm supposed to stand, to try to encourage that distancing. Again, much like when our children go into the grocery stores with us, right? They look for those spots to stand on. So similar type approach.
Can you confirm the cleaner will be able to clean the classroom in 20 minutes?
I can't answer that because I don't have a schedule yet for that person. But that would be our goal. And again, they're going in, doing surfaces and high touch areas in each of the classrooms.
Okay.
And keep in mind, if we're talking about specials, our specials are 45 minutes. So that's 45 minutes that children are out. And for recess and lunch is always combined together. So the children are out of the classroom combined with travel about 50 minutes.
Are you considering keeping doors open as much as possible to prevent high touch areas?
Yes, again, those are some of those minute details that we will definitely put in our sort of building specific plan. The thing to keep in mind with this plan really is our district plan. It's utilized in all of the buildings. And then what we're going to do is then once approved, we'll take this plan then and we're going to make it specific to East Coventry. So those kinds of things like, okay, what else can we do beyond what is just sort of here, including like, hey, keeping the classroom doors open as much as possible, those kinds of things. Bathroom doors are typically propped anyway, so the students can go in and out, without touching bathroom doors.
Okay. I'm gonna read this next question, and then I do need to join one of our other school meetings. So maybe Mrs. Cresswell will be able to read some of the others, but I'll read this last one for you. Or there's a few more after, but I'll read this one for you. Could the gym be used as a spillover cafeteria space? PE did not feel like a meaningful part of the spring 2020 learning experience. Perhaps PE should not be offered at the initial reopening phase to allow for additional space needed for more social distancing.
Okay, so again, we're going to be looking at those spaces. It makes sense to use the cafeteria as much as possible, but truly, if we can't accomplish what we need to, and then we'll look at other spaces. As far as the PE piece, we know the kids will need to be physical. I think that's an essential part of their day. We'll take them out as much as possible when weather is permitting. But you know, again, I also hesitate to kind of solve one problem only to create another, particularly with that physical activity that we know, you know, students will need. But again, we'll need to prioritize and kind of take a look at what opportunities are there within the cafeteria space to accomplish what we need to. Okay.
Hi, Mr. Oswald. Do you want to do the next three that are on here? Would you like to continue?
Are they related to either cleaning or social distancing? Because otherwise we can kind of put those in the parking lot and we can get to those at the end.
How about I do one more that refers to something you've already spoken about, and then the next two, I'm going to let everybody know. I'm going to hold off just in case the next few slides touch on that. But I will make sure that if they don't, that they are asked. So the one that I'm going to throw at you right now is going back to the procedures around a student who tests positive and the traceability. How quickly will parents, the school, be informed of a positive case? And will the district have anything available for ease of other students to take tests if they've been exposed in the classroom, hallways, that core group of exposure? Will it be required for all students to clear their tests prior to returning to school? How will students continue their social distancing if they do need to quarantine?
Okay. A lot of questions there.
It was one section.
Say that again, Mrs. Cresswell.
I promise you it was from one section.
No, I trust it. All right, so that's part of the reason why I have Mrs. Kohler on. And so I'm going to let Mrs. Kohler kind of jump in because our school nurses, you know, have worked this summer to really look at putting some protocols into place for, you know, any students who are confirmed. Now, I will tell you that that's also where our Chester County Health Department has come in and been very essential because what they've done is they've been able to provide us with any information related to, you know, questionable cases, symptomatic, but also, and we did not have a confirmed case in the spring, but had we had a confirmed case in the spring, Chester County Department of Health would have reached out to us. So I'm going to turn it over to Mrs. Kohler, and you can talk a little bit in terms of the specifics of the plan.
Yes, so if we did have a positive case, we are in communication with the health department, and we would notify them, and they would do the contact tracing with that student and their family. And then, yes, that class would be notified, and then that classroom closed and disinfected.
Okay. There was a question about communication, and we would be communicating with the families, again, part of that tracing. Who do we think potentially may have been impacted? And we would be communicating either to the students in that grade or in that classroom or the other families on that bus. If, again, it really comes down to that tracing. Is that accurate, Mrs. Kohler?
Yes, that's perfect.
Okay.
That's exactly.
And then how about the other end of that as far as sort of like return to school then? So you have a student who, let's say, let's take even school out of it. Let's say confirmed case, we're notified over the weekend, and the student then quarantines, we do everything we need to, and the student then is sort of seemingly ready to come back. What are the steps to come back to school?
So they have to be fever-free, off the medications, and not having any signs or symptoms. No,
No symptoms.
And they were also talking about retesting with negative tests, but I don't think that's been confirmed by the health department yet.
Okay, so again, guidelines change, and that very well may change and get more specificity between now and then. You know, and this is something that I shared this morning in our discussion. You know, again, I started this conversation with how much I really appreciate our East Coventry parents, and you know, we trust you, you trust us. You know, also we are going to implore our families to also you know, help us with this in terms of, you know, your child. And, you know, in the past, if your child wasn't feeling well, but you thought, I think they can make it through the day, you know, you give them a Tylenol and send them off to school. You know, listen, we've all done that. And so, but with the current situation, that is where we would encourage our families to do the right thing and say, I'm not going to take the chance of sending my child, even, you know, I think they can make it through part of the day. If you know your child and you don't think that they are feeling well, or a family member, you know, isn't feeling well, we are looking at flexible attendance policies that will need to be adopted and changed by our board to allow for you know, some of these situations that we know will absolutely come up, that a family member will choose, a parent will choose not to send a child to school because they want to err on the side of caution, maybe even go to the extent of, hey, I want to get my child tested. And the reality is, you know, you would reach out maybe to your pediatrician. You know, telemedicine right now, and our nurses in our physicians' offices are there to help and support our families. And when you have those types of questions, you're just not sure, you know, err on the side of being conservative. And we're going to encourage our families to, you know, to reach out to the healthcare professionals and seek advice. Just honestly, like we get advice from our district doctor, we get advice from our healthcare professionals that work for us, and then the health department. So they're going to help us through these situations.
Oswald and Mrs.
Yeah.
Polar. This is just a quick one because I know you're going to move on from this, but it says, is there a place where we can find the school protocol for when a student or teacher is exposed to someone who tests positive?
Yeah, so I have this sheet from Chester County. I'm not sure if it's on our website yet, but it will be. And if we had anybody who tested positive, they would be getting this sheet. This is what it looks like. And it goes step by step what to do. And yes, so that will be available for everybody.
Yep, and that will be part of the plan. I'm going to continue to go through because there is a link later on that actually our families maybe already have looked at, but it's available on our website, and that might be similar to what you're referring to. Okay, so survey regarding social distancing. We talked about ventilation already. Again, we know cleaning is on the minds of many people. Talked about transportation concerns. But that's social, that last one, SEL. So that stands for social emotional learning. So we know that our children have not seen many of their peers in several months. And we know that we're going to need to look at allowing for our students and encouraging our students to develop relationships and reestablish relationships with their friends. And so we also know that our students are going to be coming in, some of them anxious, some of them quite concerned perhaps about suddenly seeing things that look differently in the classrooms and seeing people wear masks. And we're going to need to support our students. We're going to need to support our staff as well, because our staff as well is having to sort of rethink all of their procedures, and of course our parents. So that social emotional learning piece, I don't want to lose sight of that because they're kids and their families, and you know, they're coming at it from all different kinds of you know, places. So social emotional learning will become a very essential part. All right, so here are just some other things. In classrooms without sinks, without touchless sanitizer dispensers will be supplied. So yes, all of our classrooms will have the pump type things, the foam type things, which I believe are touchless. The things outside will also be touchless to really minimize that. Arrival and dismissal. So I've met with our security director today, and we are looking at how students arrive and how we dismiss, and we may be changing some things to accommodate the increased traffic that we may have on our campus because parents are choosing to bring their children to school as opposed to putting them on school buses. So all of those things are sort of in the works and being considered and discussed. And again, as those things solidify and we get closer to school, we'll communicate those. Talked about social distancing in the cafeteria already. Conduct drills. We're going to conduct drills. We're going to encourage students when they leave to continue to maintain social distancing. But I'll be honest with you, in the event of a real thing, our kids are going to get out of the building quickly. That's my main concern, not how close they are. Again, that's our main concern as far as safety. Now, when they're out and we're taking attendance, then we'll worry about social distancing and things like that. Will temps taken for students? The answer is no. We are not taking students' temps. Again, that's where we're really going to be encouraging our families to do those pre-screening things. However, that being said, we do have some compromised students in our building, ranging from diabetes and you name it. And so for some students, we will be taking temps, and we will also be taking temps of the adults who support those students for some specific cases. All right, so monitoring student health. So this is now our third part of our plan. And again, first bullet really is talking about monitoring students' health before boarding the bus and getting dropped off. We're also encouraging, obviously, our families, if you know that a child is confirmed because of a test through a doctor, that you communicate. And often that communication is really going to be key. It's best that you're picking up the phone and talking to us. And that might precede a phone call that we get from the health department. But even if we get an hour's notice from a family prior to a call from a health department, that's an hour more that we have to sort of respond to the situation. I'm just looking over some of these as well. Bus drivers assessing symptoms. Yes, our bus drivers are not going to be taking temps. They need to be driving the buses, but they will be assessing students. And if they feel that any student might be symptomatic, they're going to be conveying that to the school when that bus arrives. And that's where Mrs. Kohler then can come into play, and she can help support us. I think some of these other things we've already talked about with the attendance policy, advising daily self-monitoring. So I'm going to go on. Key points then, we talked about wearing face masks and what that means in the classroom and outside of the classroom. The nurse has a protocol using screening questions. So if a student goes down to the nurse, she's got a protocol that will be following and going through some of those screening questions. If the student, Mrs. Kohler, and I'm looking to you, but you do suspect based on the responses that the student, may need to be tested, you're going to immediately call that parent, but we're also putting an area of the nursing suite into place. That's, for lack of a better word, kind of an isolation part. Is that correct, Mrs. Kohler?
That is correct. So we will have the student, they can tolerate, if they're not having breathing difficulties, that they can tolerate the mask. We'll keep the mask on. We'll put them in our isolation room, which was our treatment room, will now be our isolation room. So it's going to have a window so we can see the student and talk to them, and get a hold of parents right away.
And that's where we're going to, really encourage our parents, where in the past, sometimes, hey, I'll get there as soon as I can. you know, because of work or, you know, I'm out of the area, we're really going to need our parents to help us to do whatever they can to get here as quickly as absolutely possible to pick up a student who we think really should be, you know, looked at by a physician. Okay, all right. So, so these are just some things that, again, were on the survey. Many mentioned that students should be wearing masks, and we now know that that is our new state guideline. So that is actually already in place. You need more information about flexible attendance policy. Again, as the board sort of works through that, more information will be there. We do know that some students have specific needs. We've talked about that a little bit. And if your child is compromised or has special needs, we'll be working with you to design a plan that works. We talked about the importance of social emotional well-being of our students, making sure that they are being taken care of, not only academically, but also socially and emotionally as well. We know that little students, even big students, can't sit at a desk all day. So our teachers are going to be putting some opportunities into place that allow students to kind of get up and move to a place in the room that they might be able to do some independent work and that they're still safe and can give them a break from wearing the mask. OGR Cyber Academy, we already talked about that. And staff training, yes, absolutely, staff training is essential.
Mr. Oswald, I just want to check in with you. We do have some questions mounting. Are you ready for those, or are you?
Can we just finish this section and then before we go on to our last section, which is actually a very brief section, we'll entertain those. How's that sound?
Sounds great.
So these are questions for that section. We already talked about masks. The answer is yes. Will there be natural breaks for students to take the mask or the face covering off? Yes. Flexible attendance policy? Yes. We talked about students with specific disabilities. We talked about that. Will reminders be made to students on how appropriately to wear a mask? Yes. And, you know, those are kinds of things that we've already produced some videos to inform our families of parts of the plan. And so we find videos real helpful with kids and adults. And so videos and things like that will be produced, you know, to show those kinds of things. How is it appropriate to wear a mask? And then we talked about the, you know, the hybrid school option as well. So, all right, Mrs. Cresswell, our last section, let's entertain some questions.
All right, you ready? I'm going to kind of.
Not sure, but go ahead.
I'm scrolling back up to where we left off, and I'm thinking I'm at the right spot and didn't miss any from Dr. Soeder. But if I finish all of them and your question wasn't asked, please just add it again to the end. So I'm up here at any consideration for cohorts to keep groups small and contained, and also half days to reduce the number of students that are in the building at a time.
Right. So I'll answer the second part of that. That is really that hybrid option that you may have heard about in other states or outside of our area. Pennsylvania did just put in their guidelines that schools can consider hybrid options. So that could be like an A day and a B day option. So in essence, what that could mean be half the kids come on A day, the other half come on B days. That guideline just came out yesterday. So what we'll do is at administration, we'll kind of then take that information, look over it, and see if that is something that we would consider offering in addition to our Cyber Academy and obviously the in-person. And then what was the first part of that again, Mrs. Cresswell?
Any consideration for cohorts to keep groups small and contained?
So small, well, again, I think it's going to depend on the number of students who are here for in-person instruction. So, you know, it's hard for me to say what exactly that looks like. So small cohorts, you know, that to me means smaller groups of students in classrooms. You know, we're in a position where we're not looking at adding more teachers to support, you know, that increase of smaller groups. But again, I mean, I go back to, we don't really know how many students are going to be in the building. So, I mean, our 50% of our family is going to take sort of that OJR Cyber Academy option, and then obviously our classrooms would become much smaller. So we'll know more definitely after, early August, once parents have that opportunity to go in and really make that selection.
Okay, your next one is what processes will be implemented for subs coming into the building, and how do we ensure they follow all the same procedures?
Right. So first of all, we're very fortunate that the subs that come in are generally our, what we call regular subs. They're the ones that always pick up East Coventry jobs. And so we're very fortunate. We have a good relationship and a trusting relationship with the subs that come in. But there will be training, there will be information that's provided through our sourcing agency, so that all of the subs who do come in, whether they are familiar face or not, will receive that same information and that same training. So let's just generalize and say visitors. So other than subs, and we're really going to pretty much eliminate our visitors in the building, and most of the business will be taken care of through the vestibule. But let's say we have a contractor that needs to come into the building. Mrs. Kohler, I don't know if you wanted to jump in here, but we do have a process in place for any visitor that comes in. They will go to Mrs. Kohler, or Mrs. Kohler will come to them, and you'll go through sort of a series of assessments with that individual. Correct, Mrs. Kohler?
That's correct. We're going to be doing temporal scans for temperature checks. And then if that was out of range, then we would do a second check orally. And then also questions about travel, have they been exposed to anybody with the confirmed case, any loss of taste or smell, that sort of thing.
So you've got your protocols that you'll go through. Yes,
Yes.
exactly. Okay. All right. Mrs. Cresswell, I'm trying
Yes,
to keep
sir.
moving on. And I will
well-
say, how about we do another 3 or 4 minutes of questions, and then we'll move on to the last section. I want to be respectful of everyone's time. And I can always sort of connect with people later on, with any specific questions that we may not be able to get to. But let's continue to go on. What other questions do you have?
Sure. So I have, hold on, I'm just making sure because a bunch more just jumped on here. Okay. If a COVID breakout happens and school shuts down, will virtual learning also be put on hold?
No, virtual learning. So if I understand the question correctly, virtual learning would, in essence, take immediate effect. So much like in the spring, when we ended school and we said goodbye on a Thursday, and it was decided that afternoon that we would not be seeing students in the building. In this scenario, our virtual would most likely take effect the very next day, because our teachers will have had time to get professional development around some of the new platforms that we're looking at instituting. And so they would really be able to pretty much seamlessly transition from one to the other.
Are plans being made for transitions between the color phases? If we start green, are plans being made so that the transition to yellow and red isn't disruptive as in the spring? I think you just kind of touched on that a little bit.
I did. I mean, there will be new expectations and new routines that will need to be learned if we go from one phase to the other. So I'd love to say it's going to be absolutely seamless, but the reality is it is not, because we've never experienced anything necessarily like this before, where we go from, a green to a yellow phase. That's not what we necessarily experienced in the spring.
Will asynchronous instruction content be developed by OJR teachers, or will this be generated by third-party sources outside the district?
Right. So I'm going to ask if we can table those types of questions regarding sort of the instructional component, because that's where a lot of information will be shared kind of once we move and get our safety plan approved. Then our next step, as Dr. Soeder said, would then start to look at the what does the cyber option exactly look like? What do we have an option for hybrid? What if our students are in and they need to go out for a few days? Who's going to be providing those that instruction? So I'm going to ask, if we don't mind, if we can kind of put those in the parking lot and kind of focus on the health and safety plan. And just, those are great questions. And those are things that will be helpful when we then design the information sessions for your instructional options when we start rolling those sessions out in late July and into early August.
So then I'm going to try to hit on the ones that
Yep.
okay, or more of that. And it's a minimum of 3 feet, correct? Not 6 feet. I'm sorry, but I'm confused.
So the guidelines say 6 feet, but they said when 6 feet is not feasible, then 3 feet should be the target. Those were the words. The word target is in the guidelines that we received from the Chester County Health Department.
Will there be enhanced drop-off and pickup procedures to deal with the volume of kids not riding a school bus?
Right. Yeah, so exactly. What I had said earlier was that today I met with our chief of security. We walked a premise and we started to talk about how some new procedures may need to be put into place to allow for additional vehicles on the campus, both at pickup and drop off. So yep, we're working on it.
If kids are traveling to hotspots, will they be required to advise the school, and will they have to quarantine before returning to school?
Well, if you read the current recommendations, I believe even now, if you travel to a new state, it is recommended that you quarantine. It's not required. So we cannot, as a school district, require a student not to come to school and to quarantine. And again, that's where we really will, ask our families to do the right thing and share that information with us in terms of, hey, I just traveled, here are the details, and then we'll certainly advise them. But ultimately, we cannot require a family to quarantine a student if they've traveled, because right now I don't think, unless I'm not thinking of the regulations correctly or the requirements or the guidelines, that I think the word required has actually been taken out. I think it's recommend.
Mr. Oswald, one thing you've continuously said, which I think is true, is the one thing we can be certain of is change. So you never know what words will change and what things will change. Okay, I'm going to go with a few more that follow the questioning. It says, okay, that's the self-monitoring. Did the survey reveal a majority preference for in-person or cyber?
I don't know, honestly, because I don't have those, I don't have the results on that. And honestly, even if I did, I don't know how much stock I would put in that yet, because I don't think that people have enough information to truly make an informed decision. And
sorry.
I was just going to say, what will be helpful for us is, once parents have an opportunity to listen to the options, get more details about those instructional options and where, they feel that their child would best be suited and safest to receive their instruction, whether it's in the home or whether it's here, or perhaps if the district moves toward a hybrid option, we'll obviously have a better sense then. This is just pure speculation. Just talking to families and sort of hearing where they are. If I were to put my money, I'm going to say, and don't anyone write this down, but I would say a third. I'm thinking that perhaps a third of our families may choose to have their children, be receiving instruction in the cyber academy. But that's just me. And the honest truth is that's going to change. We might start out with a third, and it might go up to half. We might start at a third, and vaccine comes out in who knows when, and people are feeling much more comfortable about it, and we might find that those numbers then drop later in the year. So it's hard for me to tell.
Okay, can you still hear me? I'm sorry.
I can.
Is 3 feet adequate to prevent exposure if a kid sneezes or coughs?
If they're wearing a face mask, I'm not sure. I'm not a medical expert. I haven't done, the studies on it. I haven't looked at the studies on it, so I can't really offer that. I know what I'm hearing is that face protection coupled with washing of hands, sanitizing. What I'm hearing is those are really the most effective ways to sort of, prevent transmission. So as far as the sneezing and 3 feet and things like that go, I can't answer that. The reality is we would never be able to maintain 6 feet of distance, in a school. It's in some respects, you think about when you go to the grocery store, people are sort of coming close, walking by you. And so even in that type of situation, we're not always maintaining 6 feet of distance. Do we try that? Of course, that's our sort of our always our hope. But I think the reality is probably something a little bit different. And, that's also why we're hoping and going to be encouraging our students to wear the face protection and to wash hands frequently, have the supplies available. If a student forgets a mask, we'll have masks here. If a staff member forgets their mask, I'm sure you're fighting those same battles at home. When you get in the car, do y'all have your masks? The reality is kids are going to forget, adults are going to forget. We're going to make sure, though, that we take out of the equation that I didn't have access to them. No, we will have plenty of access to masks, face coverings, sanitizer, those kinds of things to do everything we can to mitigate the transmission. Okay?
You have about 7 left.
Okay, so if you don't mind, I'm looking at the clock, it's 7:30. What I'd like to do is let's get through this last portion. This is a fairly short portion, and then hopefully we'll have time at the end to entertain some of these questions. And they're all good questions. I also want to be respectful of your time as well. I have all night, but truly, I want to be respectful of everyone's time as well. So health and safety. So this is the last part. This is really just about the professional development. So creating a series of online videos which review general information about those kinds of things. Those are some of the things that we'll be producing. What I wanted to point out to you, and this is what I referenced earlier, I'm going to try to switch screens here, and this is the last slide, so even if we are not able to kind of get back to where we were and we need to kind of end our presentation here, it might be a good place to end. But this is on our website right now, and it is, can you still see that, Mrs. Cresswell?
I can.
Perfect.
Good job.
So this is on our website, and this is our summer plan right now. Perhaps you've had a chance to take a look at this, but this is a series of videos. But the other component that's on here, and I think it's in this area, is that sort of protocol that Mrs. Kohler referenced. So you can sort of click on this and take a look at some more detail. And like I said, I believe in this area, I think this is where we have more information exactly on, what are those protocols for what if someone is a confirmed case. But this is a really good resource on our website if you haven't checked it out. And folks, something that I wanted you to know that has been very helpful from us that you may not have a perspective on is we're the only school district in Chester County who made a choice to bring students on campus this summer for various student programs. And so that includes a few programs at the high school, but right now our, what we call our ESY, our Extended School Year Program, is occurring. And because of that choice, we wanted to make sure that we had a plan in place for those students, and to make sure that they were safe and are safe, and make sure that our staff are safe as well. And in essence, it has provided us with very, very good feedback, not only from the students, and can a second grader wear a mask? And that's been helpful for us as well. Feedback from the staff as well. And so we're fortunate that we've been able to have a plan in place that we've been able to implement and get feedback. All of the other schools in Chester County are really still in that development phase, and their plan, in essence, will go into effect for the first time, the very first day of school, when all those kids come in. So we feel like we're at a little bit of an advantage, because we've not only created this plan early, and it's allowed us to do exactly what we're doing tonight. It's allowed us to have our families provide survey information, but it's also allowed us to get feedback from both students and teachers, and from families as well, that will all be taken into consideration. So sorry to take that little bit of sidestep, but I also thought that's kind of an important aspect to share. Okay, I'm going to jump back out. All right, Mrs. Cresswell, what else do you have?
I'm proud of you. You
Yes,
got,
ma'am.
okay, here we go. So we're on to, oh, hold on. Now that just changed my vision. Okay. Is there an app that would require check-in by parents for their kids?
Check-in for parents by kids. I'm not 100% sure what that is asking. Is it related to attendance, or is it related to like pre-screening type things that parents would do every day? I'm not familiar with that. So if whoever put that would like to provide a little bit more information, even if it's offline, let me know.
Okay. How will appropriate social distancing be monitored during social times like lunch or recess?
Right. So, again, we're going to be encouraging students to, maintain those distances. But, quite honestly, kids are going to be kids. Kids are going to gravitate toward each other, right? I see that even in, sort of my own family. And so encouragement, but we're also not treating it like a punishment if a student steps, sort of within closer proximity to another student.
Can you switch between cyber learning to in-person during calendar year?
Yes, yeah. So we talked a little bit in terms of just it's going to be a fluid process. Yeah, we anticipate that.
How is the social emotional well-being of a child going to be monitored, that they are social distancing appropriately, or if other issues are arising?
Yeah. So great question. So, I've already engaged my psychologist in this conversation, and we'll be meeting with our guidance counselor, Mrs. Morgan, our mental health clinician, really to talk about those kinds of things, that social emotional piece. I have some thoughts, but they are far more of an expert in terms of that. And so it's about relationships, honestly, and that's what we're going to focus our efforts on when we get back in school. Not only relationships among students and finding opportunities throughout the course of the day through classroom meetings and other opportunities for social emotional learning, but also making sure that we're also finding opportunity for our children to be building relationships with the adults that are, providing them with instruction. And so as they get to know the children and they see child coming in and, looking a little sad, they, will be able to say, hey, you're looking, everything okay? Checking in with those students. And also our counselors and our psychologists as well, checking with teachers and checking with students as well, and being a resource if a child is struggling or is sad or just needs somebody to talk to. I mean, that's what we've always done as an elementary school, right? I mean, that's what I love about elementary school. We love getting to know our children and developing those relationships. So when they are sad or concerned or frightened, like they know that they can find a trusted adult to come to.
You're at your final 3. Oh, maybe
Okay.
4.
Okay.
Can parents walk their students to school via the Stone Pathway from the Coventry Glen development?
So the answer to that is yes. You've always been able to. Any parent could walk a child to school. The policy says no students should be walking to school. But if a parent chooses to walk a child to school, we're not going to prevent that. The only thing I would just have you think on is, yes, there's a beautiful path that leads close to the community behind us, but it leads up to the end of our property. And I think there is a little bit of a steep sort of, little bit of a treacherous hill there to get down onto our property. So just beware of that. But if a parent wants to walk their child over, they can certainly do that. But the child does need to be accompanied by a parent, and they would need to go through the regular pickup procedures at the end of the day.
Are we planning to start the school year on time this year?
At this point, yes. That would be a school board decision because they are ultimately the ones that approve our school calendar. So if there is a need to change that, it would really need to come from our school board.
Philadelphia School District just published a detailed plan on how they're handling school this year. Is OJR meeting with other schools at a higher level of a collaboration?
Mm-hmm.
Lessons learned from, say, Downingtown, who runs a current cyber academy, or other neighboring districts? How are we leveraging the other schools in our planning?
Sure. So again, love Chester County, not only for the health department, but one of the things also that happens at our central office level, starting at our central office level, the superintendents meet weekly and they are sharing those ideas. Dr. Soeder at the assistant superintendent, the assistant superintendents are meeting and discussing. And so that's evident. You can tell they're talking because on a snow day, you'll find often that all Chester County schools are pretty much doing the same thing. So yes, they've been communicating. They've always had that in place, but certainly that's continuing. And then at the elementary, like at the principal level, we also have a Chester County, like we call it a professional learning community, that we're sharing ideas about what's working, what's not, what are you guys doing? So yes, absolutely.
Have you considered starting this school year with a reduced number of attendees so that they can learn the procedures?
A reduced number of attendees. So I'm not sure, are we talking about students attendees, I'm assuming, as opposed to staff or?
I would go with that. Maybe half days.
Mm-hmm. So again, that would be a school board decision. And I can tell you that we have discussed that.
Or a phased approach was the other thing.
We have discussed that this week, that perhaps one approach could be to have students here on a half days, and that could accomplish a few things. Number one, it allows students to kind of have a soft landing back to school. It also helps support our families in that also, your children are going to be coming to school. They're going to be trying out a half a day and then coming back home. The other thing it offers, and from our standpoint, it allows us to get back together as a staff and say, okay, we did this, for a day or two. What worked, what didn't, what do we need to tweak, what do we need to change? And so I can tell you that it was discussed. It was sort of endorsed by the administrators, but ultimately any change of school calendar, you have to take a couple things into consideration. Number one, at this time, Pennsylvania really requires a certain number of accumulated days and a certain number of accumulated instructional hours over the course of the school year. Now, in spring, they waived some of that, right? So that allowed us some flexibility. We started new this year. So at this point in time, unless they waive those requirements, we do have to be kind of sensitive to, well, how many minutes do the students need to be attending school and how many days? So, you know, just kind of big picture stuff. So PDE consideration, school board consideration, but I can tell you as far as those half days, they are endorsed by, you know, sort of the administrative team that we feel like there are many benefits of those.
All right, you've got 5. How are teachers and staff being brought into this decision-making process? As much as we worry about the kids, adults are at higher risk.
So great question. So parallel to the survey that families filled out, our staff is going through the exact same process. So our staff had an opportunity to fill out the survey and respond, and then we are doing focus groups tomorrow, starting tomorrow, both virtually and in person with our staff. So getting feedback from our staff that's currently living it in our summer programs, great feedback, but then also all of our other staff has also an opportunity to weigh in as well. So, okay. All right, so you said there's 5 more?
Yes.
Okay, so then let's do this. So if we can kind of hold off on any other questions, at this point, I want to get to those 5 remaining. And then what we'll do is if anyone have follow-up questions or any follow-up comments, put it in that feedback form, or certainly you can email me directly and I'll respond to it, or I can always just copy and paste it into that feedback form as well. So, all right, so let's hear our last 5.
For those of you who are checking my counting, I think there were a couple comments in there too. So here we go. Is there sufficient substitute teacher base to address the teachers that may not want to come expose themselves?
Well, to answer that honestly, I think it's going to be a challenge because even in good times, having enough substitutes was a challenge. That was evident last year. The board put some things into place, including increasing the amount of pay to our substitutes, but talk to any school, any district, in any place as far as the state, and for that I'd probably even challenge you to go as far as national. Substitute shortages are an issue everywhere. We're fortunate because a lot of substitutes want to come here and do want to work here. We try to treat them as well, as good as possible. But I do anticipate that we're going to have to be creative, as we've always done, with, hey, what happens if we have a shortage? How can we utilize our existing staff?
So you have 2 thank yous, a thank you very much and a thank you so much for helpful information to be able to make the decision.
I hope so, and I appreciate that. And again, you know, if you join me at the beginning, we're still at the top of the big funnel. There's a lot more work to be done.
You still have 3 questions.
Okay.
As I have looked over OJR exclusion from and return to school requirements for COVID, in it says a child shows COVID-19 symptoms, which are like that of a cold allergies. Will all children who have a runny nose or cough be sent home? Will they be required to have a COVID test in order to come back? I see on the form it only says should be tested.
Okay, so Mrs. Kohler, I'm going to look to you because it's my understanding you are looking at multitude of symptoms when you sort of do that initial type of assessment of student ends up coming into the nurse, right?
Yes, that's correct. So there's the prevalence with COVID, the symptoms like a fever and a cough, shortness of breath, or respiratory concerns, that we only need 1 symptom to exclude them from school, and we recommend that they contact their physician. Their physician may or may not want, depending on their assessment, you know, have they been exposed to anybody, that sort of thing, decide to test them. On the other hand, if they just have a little bit of congestion, we're not going to send them home necessarily because that's not a prevalent symptom unless it's combined with something else like a headache and a cough, or a headache and a sore throat. Then you have 2 symptoms that could be related to COVID.
Okay. Hopefully that was helpful. Thank you, Mrs. Kohler. You articulated that much better than I could have.
Okay, so the next 2 or 3 comments went back with one of the former questions. So I'm going to jump down to, when a vaccine is available, will all students be required to get it in order to remain in school, similar to other vaccines they are already required to have?
Right. So again, Mrs. Kohler, you're welcome to jump in here. So the current requirements are created by the state. What vaccines and immunizations students currently need. So that would not most likely be a district decision. I guess that would be a state decision in terms of an exclusion.
Correct. So that would be a state decision. However, just with other immunizations, a parent or a student may have a physical or mental or medical exclusion or a religious exemption that would preclude them from having that vaccine. Otherwise, if the state mandates it, then yes, you would be mandated to get it within a certain amount of time.
Okay. Thank you. Mrs. Cresswell, I do see a comment here about half days.
Yep, you're at the last 2 then.
You're right. So, you know, we certainly take that into consideration, and for as much as we say, hey, this could be a really good thing for a multitude of reasons, we can't lose sight of the fact that, you know, that also could be an inconvenience for many of our parents as well. So, you know, certainly that is acknowledged, and we do certainly take that into consideration. So again, as far as that feedback goes, that's a great sort of comment to kind of capture on that feedback. But yes, we would definitely take that into consideration as well. What is the impact, both sort of positively and negatively, of increasing our half days? Okay. So I see the question, and what are the next steps? So Monday night, I encourage you to join the board discussion. That is where their plan with the changes that have been you know, discussed and put into place will be presented to the school board on Monday night. And then really from there, then our focus becomes about the instructional, the cyber options, and in person, and communicating all of that information. Okay, was there anything else, Mrs. Cresswell, that I may have?
No, and like I said, parents, I hope that I didn't leave any gaps in between where Dr. Soeder left off and where I picked up, and I tried, if there was an overlay, to make sure that the questions were asked. But I think you got them all. And like you said, Mr. Oswald, if we missed any, they can certainly reach out to you.
Well, 20 of you made it to the end, so I congratulate you. But again, let me just conclude with number 1, thank you for filling the survey out. And then even more so, thank you for taking time out of your evening for the last 2 hours to spend with us. Again, this feedback is vital, it's essential, and we do listen to your feedback. Doesn't mean we can implement everything, because there's a multitude of sort of opinions, but we listen to themes, we listen to patterns, and we do the right thing for the right reasons. So with that, email me if you have any questions, fill the feedback form out if you haven't had a chance to already. All right, everyone, have a good night. Tell all your kids I said hello. All right, take care. Thank you. And thank you, Mrs. Kohler and Mrs. Cresswell. Take care.